Welcome friends, I am Dr. V.K. Chauhan, homeopathic physician. Revise with me homeopathic remedy Bromium. This is part 7 clinical correlation and the text is taken up from Ellen's keynote, and this is a good study for homeopathic BHMS students and interns. So let us go ahead with that. We have the first PQR from Ellen's keynote. It acts best but not exclusively on persons with light blue eyes, flaxen hair, light eyebrows, fair delicate skin, blonde, red-cheeked, scrofulous girls. So this is something about the constitutional aspect of bromium. And why the constitutional aspect is important for us, because it has got the hidden dimension which we call the diathesis. You have the constitutional weakness, you have the genetic weakness, you have the intrinsic weakness to develop certain diseases, but in due course of time, when the environment is suitable and exciting factors are there. So here this constitution which belongs to bromium, as explained by Ellen, these features point to predisposition to certain diseases, as we already called as diathesis. These subjects are at high risk to develop scrofula. And clinically, what is a scrofula? Scrofula, historically known as king's evil. It is the tubercular cervical lymphadenitis caused by hematogenous or lymphatic dissemination of pulmonary tuberculosis or reactivation of latent tuberculosis, or very rarely through primary involvement of adenoids or tonsils. This is extrapulmonary tuberculosis, which is more common in people with weak immune system and young children. Let us go to PQR2, sensation of cobweb on the face. We have Beritacar, Borax and Graphitus, similar remedies here. And let us recap. The above features point to feeling of a spider web on the face, where no spider web physically exists. So therefore it is a kind of formication or kind of tactile hallucination. It commonly occurs during the night. The clinically importance of this particular feature is you have to rule out the functional cause, and if at all there is some pathological condition is present, just investigate and find it out. So common causes include withdrawal from the alcohol or drug, anxiety, fibromyalgia, Parkinson's disease, diabetic neuropathy, herpes and perimenopausal, and multiple sclerosis, the great mimicker. We go to PQR3 and here we find fan-like motion of the Elanasi. We have two more important remedies here, antimonium tart and lycopodium. Let us recap. This is a child who has got flare, nasal flare, and nasal flaring occurs when nostrils become white while breathing. It indicates respiratory distress. And clinically, we find this situation most often in children between age group of 2 and 6 years with serious respiratory conditions which may be as acute asthma, pneumonia, bronchiolitis, or croup, which is the inflammation of the larynx and trachea. The larynx, which is the shortest, you can say narrowest passage in the respiratory tract we have. The PQR4 sailors suffer from asthma on shore. So this is a particular general, and it corresponds to respiratory system, and here we find the asthma which is triggered at seashore. Now the causes of asthma include outdoor allergens. Say for example we have pollens from grass, trees and weeds, air pollutions, irritants such as smoke, and outdoor allergens like pet, dander, dust, mice. Indoor allergens include pet dander, dust mite, and mold. So it can be anything which is responsible to cause exciting cause in people who are sailors who come on the shore. So there can be pollens and there can be dust mite also. PQR5, stony hard scrofulous or tuberculous swelling of the glands, especially of the lower jaw and throat, thyroid, submaxillary, parotid, and testis. Here we have taken the example of thyroid nodule, which is a hard nodules. Generally, hard nodules are because of cancerous, and it has got different stages we have to keep in mind currently. So if it is T1 stage, we have it is 0 to 1 centimeter. T2 stage, we have 2 to 4 centimeter, but within the gland itself. And T4 here, we find that it is just going beyond the gland, and T4A is just going beyond the gland, and this is by the side of thyroid gland. We have carotid artery, jugular vein, and there is a vagus nerve. So they can eat up these particular viscera which is present in the neck. But it is T4B which is extensively eating up everything in the neck region. So clinically, stony heart swelling, as we have been talking, they are cancerous, and they are very commonly involving thyroid gland and testis. At least this illustration, as I have been talking about, depicts the different stages of malignant growth which is involving the surrounding tissues. The same thing which we talk about, the scrofulous swelling or tubercular swelling. So this is a very old photograph when it was very common before the antibiotic era. In the cervical region, there are sinuses are formed. Clinically, tubercular or scrofulous glands. The disease is caused by mycobacterial cervical lymphadenitis, also known as scrofula, involves involving a lymphadenitis of the cervical lymph node. And we find that in later stages these suppurate and discharge through a sinus, and in neck region they form the collar stud abscess. Anyway, so PQR6, we talk about, Ellen talks about diphtheria, where the membrane forms in the pharynx, beginning in the bronchi, trachea or larynx and extending upwards, chest pain running upwards. So membranous diphtheria or croup, there is a much rattling of mucus during cough. This is PQR7, but no choking. Sounds loose but no expectoration like antimonium tart. And we have the clinical correlation. We find this is the diphtheria, which is the membrane which is involving the tonsils and pharynx here, and even the posterior aspect behind the tongue which we can see. It is a serious infection, and the causative organism is Corynebacterium diphtheriae. It can lead to difficulty in breathing, heart rhythm problem, and even death. And we have to keep in mind that in current national health programs, especially recommendations of Government of India, we have vaccines for infants, children, teens and adults to prevent diphtheria. However, if diphtheria occurs, it is a urgently notifiable condition that must be notified immediately to the department by medical practitioners, and they needs to be treated in infectious disease hospital. Anyway, so PQR 811, we have croupy symptoms with hoarseness during whooping cough, grasping for breath. And let us recall, this is the vocal cord, which is the narrowest part of the respiratory tract. If any inflammation takes place, obviously it causes respiratory distress. So it is a upper respiratory tract infection which becomes serious as it causes difficulty in breathing because of narrowing the passage. And this croup is very common in children between 6 months to 3 years of age. They present absolutely two symptoms which are very important: barking cough and stridor. Stridor is a high-pitched sound that goes with breathing. It comes from swelling in the upper airway near the vocal cords. In severe cases with a stridor, the child can exhibit shortness of breath. PQR9, it talks about dyspnea cannot inspire deep enough, as if breathing through a sponge or the air passage were full of smoke or vapor of sulfur, rattling, sawing, voice inaudible, danger of suffocation from mucus in larynx. So let us recall, this is a inspiratory dyspnea we have, and it occurs primarily when there is obstruction in the larynx, trachea and major bronchus, such as inflammation, edema, tumor and foreign body. Clinically, acute laryngotracheobronchitis is the most important condition we need to keep in mind, and in this particular diagram there is a good representation of the salient features of laryngotracheobronchitis. It shows here onset is slow, barking cough is there, crowing sound while coughing, inspiratory stridor is there, occurs at night in fall and winter especially, may progress to hypoxic state, may have slight temperature rise, commonly occurs between the age of 5, upper respiratory tract infections frequently precede lower tracheobronchitis, restlessness is there, suprasternal retraction is also there, and increased respiratory rate is classical. So friends, let us go to PQR10. Here it shows about the hypertrophy of heart from gymnastics in growing boys and from calisthenics in young girls. So let us recall, a normal heart having a very normal ventricular thickness, but in case of enlargement of ventricular walls, right and left both, there is a kind of there is a stroke volume is good because the ventricles dilate also. So in athletics, this kind of athlete's heart develops, and we know that there is an increased heart mass and there is a normal cardiac function, and after some time if you leave the athletics, probably it will come to normal. However, athlete's heart or exercise induced cardiomegaly is a non-pathological condition commonly seen in sports medicine, and in this condition the human heart is enlarged and the resting heart rate is lower than normal. So this is the echo of the heart where we can see the ventricular non-athletic size, means it is a normal kind of a thing, normal heart, and here we find the chambers are enlarged. And athletic heart or hypertrophy of the cardiac muscles. It is a you can say, again we will redefine it. It is a structural functional and electrical remodeling that accompanies regular athletic training. Further, it has got following features: a electrical component where we find bradycardia, voltage criteria for chamber enlargement is present. Second, structural, where we find increased chamber wall thickness and cavity size, and functionally we find enhanced diastolic filling and increase in stroke volume. So athletic heart syndrome can take place where we find a benign cause of the cardiac enlargement that occurs in athletic training. A cardiovascular symptoms like dyspnea and chest pain do not occur. The physical examination may reveal bradycardia, sinus arrhythmia, premature beats, and an apical impulse that is enlarged, laterally displaced, and prolonged. ECG findings during rest include sinus bradycardia, first and second degree atrioventricular heart block, and right bundle branch block. These condition is, again we are reminding, is benign and does not require any treatment. So we go to the PQR11, the physometra, loud emission of letters from vagina, and membranous dysmenorrhea. We have two important symptoms from the female sexual system here. So let us recap. Physometra, we have vaginal flatulence, also known as queef. It is a common during intercourse or placing a finger, tampon, sex aid, or speculum into the vagina. More episodes of queef were reported during pregnancy and menopause, after childbirth, causing pelvic floor muscle weakness. A study in 2012 in the journal ISRN Obstetrics and Gynecology reported low body mass index and young age with a higher incidence of queef. We go to PQR12, cold sensation in larynx on inspiration, better after shaving. So let us recap. The cold sensation in throat can be because of throat and abdomen causes where sharp burning from tongue to stomach takes place. This is kind of a GERD, symptom of GERD. It points to a acid reflux. Yes, it is of course GERD, which damages the soft esophagus as well as laryngeal lining, and the sensitive underlayer is exposed. Each time when Bromium patient eats, drinks, or even breathe, they get a chilling or minty sensation in their throat. Others include respiratory tract infection and anxiety. So friends, thank you very much for patient listening.